Hi, my name is Sean Jeffery, and today I'm joined by Rod Marriott, who happens to be Connecticut's Director of Drug Control. And Rod and I have had the good fortune of being able to work together over the past several years in a variety of different formats and forums. It started with work around Connecticut's response to the opioid crisis, where Rod's been serving as sort of an ex officio member of Hartford Healthcare's Opioid Stewardship Council. That work also then spun out into some additional work that we've been doing around medication reconciliation. And in particular, Rod was a member of a committee that I co-chaired called the Medication Reconciliation and Polypharmacy Committee, part of the Office of Health Strategy. And we've continued this journey around data and how data flows and the needs of prescription data by various different entities into CONI, which is Connecticut's Health Information Exchange, where we're both working on a best possible medication history user group. So we've got quite a bit of time that we spent together. And over these many years, we thought it would be fun to do a discussion about sort of what are the things that are coming up in pharmacy that he sees in his role as drug control, and have a chance to pick Rod's brains. So we're going to do a little informal discussion. So Rod, I don't know if there's anything else you'd like to add. Tell us maybe a little bit more about yourself.
Yeah, so I'm a pharmacist by my training, and I work in the Department of Consumer Protection and Drug Control Division. And I've been very grateful for these opportunities, from the Opioid Stewardship Council to our med reconciliation work, and some of our more current interactions around the best possible medication history work. And really, the exciting part about this is I think we're trying to make pharmacy, but really healthcare, better by working together to change some policy and really protect consumers.
Yeah, speaking of policy stuff, I'm completely forgot to add the work that we've been doing lately, which seems like it's every single day we've been having to touch base around the current legislative calendar, and in particular, the agency support that you've given us around SB 186, which is the revisions to Connecticut's collaborative drug therapy agreement laws, and also HB 5223, which is the act concerning adding pharmacists as regulated professionals to the provider assistance program, Haven. And we've been able to partner really close on those. To me, it's the way that ideally things should work when you bring a coalition together and then work closely with the regulatory body and the agency to come up with what's going to be the best solution, as opposed to trying to jam something through. This has been, for me, a pretty exciting process. So thank you for everything that you've done to help make that happen.
Well, you're welcome. I think both of those are very exciting bills for the profession and for healthcare. Right, collaborative practice is an area I think that really is where pharmacy is going. Mm-hmm. And I think again, the potential benefit to patients, but also to the providers in the care settings, I think is really an area that some of the country has already gotten to. We are pushing into that a little further with some of these bills, and I really hope they're successful. And you're right, it's better. These are better situations when we're working together on them, and I think it actually brings a better outcome.
Yeah, and Rod, I'm running for president-elect of the American Pharmacists Association, and one of the things that they've asked me to think about and prepare for potential address is, what does pharmacy look like in 10 years? And I really think that collaborative drug therapy is one of those pivot points or hinge points that has to really change in order for us to get to that future state of where we're going to be truly integrated. We're going to be working more closely with our provider, prescriber colleagues, and helping to manage and offload a lot of what they're currently doing around managing prescriptions and managing the refill process and managing the day-to-day titrations and concerns that patients have around chronic disease medications. So I think in that case, the pharmacist is uniquely qualified to be that extender of the provider, but we can't extend given the current restrictions that we have, not just in Connecticut, but in many states around collaborative drug therapy.
Yeah, and I think you're right about that. I think that's really where the profession is moving. The law is part of the hindrance, and many people will tell you that the payment structure is part of that hindrance. I think really, pharmacists are really there, bridging a big gap, and the maintenance and management of medication is really the wheelhouse, especially in today's training of our professionals in college. And I think that as we move forward and try to find ways to optimize that, I think it has a potential of a number of really great benefits, from reduction in cost to the patient directly, healthcare costs, which are always a big topic of conversation, and really helping the providers optimize treatment, um, because they have enough to manage. And really, as you think about it, the- thousands of new drugs are out since I started practicing pharmacy, and it's a daunting thing to even try to remember them. Now, I haven't been on the bench in some 13 or 14 years, but I do try to keep up with all of these things that are happening in the profession. I'm really excited for that opportunity, because that was what I went to pharmacy for, is to help patients out. And I think the this opportunity is what I imagine more. And when you really look at some of the stuff that Connecticut has done, in particularly in its medical marijuana program, the pharmacist has a really unique opportunity to help select product, identify product, and optimize therapy for patients based on interviewing them and kind of almost having little visits, should they need to really kind of find the best opportunity for a patient. And if we can take that model into kind of the traditional practice of pharmacy, I think we can really do some good things.
And correct me if I'm wrong, but those visits, as you just described, those are scheduled, aren't they?
Yeah, a lot of times that they have appointment based visits. In many times on the first visit from any patient to a dispensary, they have a discrete period of time where they meet with the patient, discuss the condition that has been identified as debilitating, and best ways to kind of treat that, in a step by step approach. It's almost like the practitioner makes the diagnosis and the pharmacist picks the therapy.
And that's very much in line with the way that provider offices work. They work off of scheduled appointments, and they can control the workflow and the amount of volume that's coming in based on the amount of time that they have. And that's not what happens in a community pharmacy right now. You never know on any given day what kind of volume you're going to have. And it really does, unfortunately, create workplace dynamics that are very stressful. And that's one of the challenges. I think, to your point, if we can get towards that state where we have the ability to have pharmacists working in a collaborative role with their prescriber, where they have defined blocks, appointments for patients, everybody's going to win there. They're going to have a better outcome and more quality experience and interaction with the pharmacist. And there's probably going to be a lot less downstream questions that trickle back to the practices, because the pharmacist is going to be able to answer a lot of that up front.
Yeah, I certainly hope so. It's that's always a balancing act, right? One of the things that makes pharmacy so great is its accessibility to the customer.
Yep.
So finding that balance is really going to be interesting.
Yeah. So let's pivot just a little bit here. We've been kind of talking about how the wonderful things that might be happening, but tell me, from your perspective, what are some of the things that currently keep you awake at night?
I think one of the biggest things that keep me awake right now is really sterile compounding. Sterile compounding is a complex process, and that those injectable or parenteral medications obviously have immense value to our system.
Yep.
And without some of that work, some of the treatment that we have available to us may not be feasible. Um, but at the same time, it also poses a risk at the compounder level. The great part is we made tons of strides since NECC, both in Connecticut and nationally.
And
But it doesn't
NECC, for
take
those
much.
who may not remember, is the New England Compounding Center. That was the pharmacy up in Massachusetts, correct? That led to a lot of the changes.
Yeah, so they ended up having a situation that caused a large number of meningitis cases and a lot of patient death. And so, as a regulator, those things keep me up at night. I'm fortunate to have a really strong team of inspectors around that space, but it is really challenging with non-resident pharmacies and product coming in from outside the state.
Yeah. We touched on it a little bit earlier about the workplace and some of the challenges there. But what I'm seeing in my role as a trustee is a lot of concern about workplace burnout. APHA just recently had a workplace summit where we brought employers together with employees, sort of as a first step to begin some courageous conversations about what needs to change. I know that one of the large chain pharmacies recently announced that they're going to be providing structured breaks for their pharmacists. So, the burnout is a significant issue. So how would you advise pharmacists and other professional societies to potentially combat this? What else can be done?
Well, I mean, I think that summits like that are really important, because many times those are employee-employee relationships,
Yeah.
and the associations can really help pharmacists, acquire a voice, that is, maybe more impactful at times. And so I'm hopeful that things like that can help. Just a few months ago, we got through some regulations for shared pharmacy services.
Mhm.
And shared pharmacy services, I think, are is really potentially important, for helping pharmacists manage the workload that isn't time sensitive. So when I think about time sensitive workload, I think about our vaccines. I think about maybe some of this testing we're doing, your
Mhm.
urgent prescriptions, your antibiotics, things like that. And so this really, if shared pharmacy services can manage some of the kind of refills, um, maintenance medication situations, I think it's actually going to be better for pharmacy as a whole. Really allow pharmacists to stay connected to the community, that's there, and handle some of those routine processes outside of the pharmacy proper, but still have the patient come to the pharmacy. That accessibility, I think, is what's critical. We have some almost 700 pharmacies in our tiny little state here in Connecticut, but every one of them brings value to their community,
Mhm.
and that value is, being able to pick up that ibuprofen for your kid at 9 o'clock at night, when that fever pops up out of nowhere, getting some advice about a cough syrup or an allergy medication because you're having a hard time sleeping, and trying to get through some of that. And so having those physical storefronts, I think, is really, really important. And shared pharmacy services is a way to potentially optimize the work that's going on in those pharmacies. But it also provides opportunities for pharmacists who maybe can't stand for those long durations, or maybe they have worked a bunch of days on the bench and could use a lighter day where there's not maybe as many distractions. And maybe it can help with some of those quality of life issues at times for pharmacists. So I'm hopeful pharmacies can take advantage of these rules. I had the pleasure of writing them during the pandemic while I was reviewing all these other rules, and it finally kind of tipped the scales and was pushed me to do it and really kind of finish them up and get them forward. And I, I hope they can find value.
One thing that the pandemic, I think, showed to the rest of the world that they took for granted is that pharmacists are accessible, we are reliable, resilient, and really indispensable, especially to our communities. And the services that we continue to maintain throughout the pandemic are truly laudable for everybody who had stepped forward with all that discretionary effort. Can you tell me a little bit, though, about how the shared services might work? I'm envisioning something where it's maybe a partial remote opportunity for somebody to be maybe doing order verification. Or how did you write the regs?
So it's actually a multifaceted approach. So the the pharmacy can have remote order entry,
Mhm.
remote order verification on the order entry, and do some work like that in a remote fashion. But the dispensing, the actual production part of the function, the pills in the bottle part, and that final verification now can also be shifted to another pharmacy,
Okay.
and then that pharmacy can deliver that product back to the original pharmacy.
All right.
And so that was something that couldn't be done before, um, at least in Connecticut state rules. But it really does allow that to function. So some of that work is taken off site on schedule. And so those pharmacists who have those big towers of people that aren't waiting, can move that work potentially to another location, and then it will kind of arrive in their facility.
Now, I imagine that is confined within Connecticut. What happens if there's another, let's say, player in the space that wants to make a push nationwide to have a distributed shared pharmacy service platform? Do you see that that's a reality, or will state laws preclude that from happening?
Actually, we wrote this law to allow for a non-resident pharmacy to fulfill that work.
Okay.
There are contractual requirements and licensing requirements for that non-resident pharmacy. We already licensed the non-resident pharmacies.
Mhm.
It's kind of like a version of reciprocation. So that could work now, and those pharmacies would be held responsible for errors and misfills and things along that line as well.
Okay, that kind of leads naturally into my next thought for you, and that is, as you start to look across the pharmacy landscape, both locally and nationally, what are the changes that are coming that are going to get you excited?
Well, I mean, I think this collaborative practice stuff is really what's most exciting to me, mostly because I think the impact to the patient is really potentially great. Um, so I think the optimization of some of this technology to allow for that pharmacist to find that best possible medication history, to play a role in the care team in that way, ultimately optimizes therapy on a multi-tiered approach. And I think when you look at that, those are the things that really are going to change pharmacy and the customer experience in healthcare.
Yeah. I know that with the two of us and the work that we've done around the data and the prescription data elements and how that potentially flows through different systems, we both can see and envision a day where there's a best possible med history that is the closest source of truth to what the patient's actually taking. That is interoperable and shared, and we have an opportunity for both the prescriber to amend and change and see things, as well as the patient to comment on their prescription. And a lot of that is only going to happen if we have good data standards, the interoperability, and we have folks like yourself who can see the value and can be pushing and driving that train. So thank you for all the work that you've done in this space and continue to do. Is there any last thoughts that you have, things that you want to wrap up with?
Sean, I really appreciate your comments there. I remember probably a presentation you did either before I was director, seeing pictures of people in their homes with a table full of medications.
Yep.
And thinking how powerful those pictures are. And I continue to draw on them in those meetings that we have, and trying to think of ways to change that. We've been very fortunate with our prescription drug monitoring program to really deliver that information in I would say, both timely and efficient ways to the practitioner.
Mm-hmm.
Now all of these data points are critically valuable, but if they're delivered in a way that people can't use them, they become useless and just a burden on the practitioners that are and providers that are reviewing them. So like everything, it's not just, there's no one size, there's no perfect solution.
Right.
We need to just keep driving certain values forward, listening to those things, and trying to advance the patient experience at the end of the day.
Yeah. And so many things in life, it all comes down to communication and maintaining those open lines of communication, which is one of the benefits of working with you in your office. You've always been very receptive to the pharmacists and the other health professions in Connecticut. So Rod, thank you once again for your time today. I appreciate the conversation, and this is pretty fun. Maybe we ought to do this again. We could have a standing little show here.
Yeah, look, I'm enjoying it as well. I think this is really good, and it is really fun to be able to share this information in a different way.
Awesome. Thank you.
Thanks, Sean.